Welcome to our comprehensive guide on physical status modifiers in Anesthesia CPT coding guidelines. Understanding this crucial component is essential for accurate coding and billing. Welcome back to my YouTube channel. If you are new to my channel, welcome to MedCode Insight. Hi, I am Nishaba, a certified medical coder. Today we embark on a journey to the nuances of anesthesia CPT coding guidelines, shining a spotlight on physical status modifier. Let's dive in and enrich our understanding together. Physical status modifier. The anesthesia physical status modifier is a classification system used by anesthesiologists to assess a patient's overall health before surgery. It ranges from P1, normal healthy patient, to P6, declared brain dead patient whose organs are being removed for donor purposes. The six levels are consistent with American Society of Anesthesiologists ranking of patient physical status. It helps in determining the level of risk associated with administering anesthesia. Physical status modifiers are represented by initial P followed by a single digit from 1 to 6 as defined in the following list. P1, a normal, healthy patient. P2, a patient with mild systematic disease. P3, a patient with severe systematic disease. P4, a patient with severe systematic disease that is a constant threat to life. P5, a moribund patient who is not expected to survive without the operation. P6, a declared brain dead patient whose organs are being removed for donor purposes. For better understanding, let's discuss each component individually. Modifier P1. In the context of anesthesia physical status modifiers, it indicates a normal healthy patient. This means that the patient has no systemic disease or other significant health issues that would affect their response to anesthesia. Patients classified as P1 are considered to have the low risk for anesthesia administration. When the healthcare provider performs anesthesia on a patient with modifier P1, it suggests that the patient's overall health status is favorable, that can simplify the anesthesia process and reduce the likelihood of complication during and after the procedure. Modifier P2. In the context of anesthesia physical status modifiers, it indicates that the patient has mild systemic disease. This means that the patient has a mild medical condition or multiple mild conditions that may affect their overall health status but are not considered severe or life threatening. Patient classified as P2 may have conditions such as controlled hypertension, well controlled diabetic mellitus, mild asthma, or other mild systemic disease that do not pose a significant risk during anesthesia, but may require careful monitoring and management during the procedure. When a healthcare provider administers anesthesia to a patient with modified P2, it signifies that the patient's medical condition requires some consideration and may slightly elevate the risk level associated with anesthesia administration. However, with proper preoperative assessment, monitoring, and management, anesthesia can generally be safely administered to these patients. Modifier P3. In the context of anesthesia physical status modifier, it indicates that the patient has severe systemic disease. This means that the patient has one or more severe medication condition that significantly affect their overall health status and may pose an increased risk during anesthesia administration. Patient classified as P3 may have conditions such as unstable angina, poorly controlled hypertension, symptomatic chronic obstructive pulmonary disease, or other severe systematic disease that require careful assessment, monitoring, and management during anesthesia. When a healthcare provider administers anesthesia to a patient with Modifier P3 designation, it signifies that the patient's medical condition requires attention and may have increased complexity and risk level associated with anesthesia administration. Anesthesia for these patients often need close monitoring, careful titration of medication, and potentially specialized anesthesia techniques to ensure safety and optimal outcomes. Modifier P4. In the context of anesthesia physical status modifiers, it indicates that the patient has severe systemic disease that is a constant threat to life. This designation signifies that the patient has one or more severe medical condition that significantly compromise their overall health status and pose a constant risk to their life. Patient classified as P4 may have conditions such as decompensated congestive heart failure, end-stage renal disease requiring dialysis, severe uncontrolled diabetes with metabolic derangement, and other life-threatening systemic diseases that require careful assessment, monitoring, and management during anesthesia. When a healthcare provider administers anesthesia to a patient with a Modifier P4 designation, it signifies that the patient medical condition present a significant challenge and substantially increase the complexity and risk level associated with anesthesia administration. Anesthesia for these patients often required specialized expertise, meticulous planning, and close coordination with other healthcare providers to optimize safety and reduce potential complications. Modifier P5. In the context of anesthesia physical status modifiers, it indicates that the patient is moribund and not expected to survive without the operation. This designation signifies that the patient's overall health status is extremely poor and their condition is terminal or near terminal. Patients classified as P5 may have conditions such as end stage cancer, severe trauma with irreversible organ damage, or other life limiting illness where surgery is considered a last resort option to potentially prolong life or provide palliative care. When a healthcare provider administers anesthesia to a patient with a modified P5 designation, it signifies that the patient medical condition is critical and the risks associated with anesthesia administration are high. Anesthesia for these patients require careful concentration, often involving discussion with the patient, their family, and other healthcare provider to weigh the potential benefits against the risk. Modifier P6. Modifier P6 indicates that the patient is declared brain dead patient whose organs are removed for donor purposes. It means there is irreversible loss of all brain function and they are being maintained on the life support solely for the purpose of organ donation. Patients classified as P6 are not responsive, do not have any brainstem reflexes, and medically determined to be incapable of regaining consciousness or independent respiration. They are being kept on life support to preserve the viability of their organs for transplantation to save others' life. When a healthcare provider administers anesthesia in the context of organ donation from a patient with a modified P6 designation, it signifies that the patient status is unique and ethically complex. Anesthesia in this situation is administered to the donor during the organ retrieval process to ensure that the process is performed safely and without causing pain and discomfort to the donor. In the next video, we will cover the remaining components of CPT anesthesia guidelines. If you have any question or need further clarification, feel free to ask in the comment section or reach out via email. Thank you for watching. If you enjoyed the video, please share it. Your support means a lot to me. If you haven't already, consider subscribing for more. Click the bell icon to receive notifications. For more detailed guidelines, CPC mock or exam related questions and notes, email me at my given email ID.